changes happening in the new year, 2027. And so here's what we know now. Well, Part D, drug costs. We have an increase to the deductible. It was 595. It jumped up to 615 this year, and now it's going up to $700. Deductible, of course, is what you pay out of pocket for your medications. You pay the full amount until you reach that dollar amount, 700 next year, and then the plan kicks in and you pay, whatever the negotiated price is for your carrier, for that medication, that tier, and that pharmacy. So you may want to just double check with your carrier, your insurance company, and say, is this pharmacy giving me the best dollar amount? Because as we have changes year to year, that's one of those things that's easy to lose track of, and that can save you some money. The other cap that is going up, it was 2000, and now then it was 2100 this year, and now it's going up to 2400. And this, of course, is the maximum that you would pay for medications. And then once you reach that amount, basically any Medicare covered prescription drug will be taken care of for the rest of the year at that point. So they've done away with the donut hole situation, which was horrible. It was a surprise in the middle of the year, and there was weird internal math you didn't know. And anyways, I'm so glad that's taken care of. It's more straightforward, but on the downside here, it is trending up. Another thing that's trending up is the Medicare premium. Right now, it is let's see, last year it was 174, then 183. This year's 202.90, and next year they're still figuring this out. 209.50 is one number. Other forecasters say it's going to be closer to 218, whatever it is. Yeah, we can be sure it's going to climb up as well. One other thing, CMS won't confirm the real number until November 2026. So anything before you hear then is really just an estimate. IRMAA, this is something that people, I think, worry about that shouldn't. Don't worry about IRMAA. IRMAA is Part B that is an additional amount if you are earning higher than this year, if you're earning higher than $109,000 if you're per year if you're single, and is basically double that if you're married. There is an estimate of 2027 is going to go up to 112 if you're single, basically double that if you're married. So my gut feeling is if you're nowhere near that, don't worry about that. If you are at that point, don't worry about it. I mean, you've got the income, just pay it. You know what I mean? It's the per dollar amount increase on Part B relative to that is not very much. A few $100s here and there after you're making way more than like what most people are in the country. I think you're fine. Sorry, that's my gut feeling. Okay, so the next thing is carrier moves. We expect carriers to move in and out of market footprint. This is a business, right? So they will, there's always big data that they look at. All of the plans, Medicare Advantage plans, have networks. These doctors move in and out of these provider groups that get contracted with different carriers and things in different areas. And so the carriers are always looking at this information and saying, okay, well, we're going to pull out of 109 counties this year. Okay, so they're probably reallocating resources into other places where they have less competition, and they're able to bolster up hopefully service in their clientele in other areas. These changes happen all the time, every single year. We expect this to happen. The trend has been that um, plans are ending. There's a couple of factors. Like I just mentioned, there's these changes. Well, some of the changes are basically we have new carriers that have come in. They've overextended their hand and then just kind of petered out. So this is all because the backdrop of the silver tsunami, the baby boomer generation aging into 65, aging into Medicare. We're basically halfway through that point. We're on the downside now. 2025 was the peak of that at close to 12,000 people per day aging in. And so we still have another stretch of a decade and then it'll taper off, but it's still a massive amount of increase on a year to year. So that is the trend uh, projected going forward. It's growing, but some you still see some of these people pulling back, or not people, carriers pulling back. It's because of this certain areas. This is all strategic to increase their bottom line. Point link. So what this means is you need to have me looking at your situation year to year to see your needs change, your plan changes, and your options change. So we need to do a review every year, but that's not all. You need somebody who's going to be consistently that one person that's going to have the conversation rather than having multiple exhausting Medicare conversations every single year, trying to find the best deal. Do yourself a favor. If you trust that person, trust me, I will take care of you. And I also want to be a resource to you throughout the year, which is, why we're doing this. So that is a couple things here. There's a tax deduction connected with $6,000 senior deduction. This actually, it went into effect last year, but this does affect people starting out at $75,000 income for a single, and then basically double that if you're married. What this effectively is trying to do is offset taxes for Medicare. So you need to talk to a tax person to help you out with that and mitigate taxes further if you need to. But annual enrollment period is coming up in October, October 15th through December 7th. As you well know, in September, you should get an annual notice of change sometime in that year, in that month. Take a look at your plan and look at the changes coming up. You might get a notice that says the plan's not going to be there anymore. So if you miss all of this and you find yourself in January at the pharmacy trying to refill and you don't have a plan, you have 2 months. In that month, though, you are basically reverted back to original A and B Medicare with no prescription coverage. And, it's that's not awesome, especially feeling, so vulnerable, interrupting your entire coverage and everything. So it is possible to get back on track. It does take, you have a 2 month window to get back on track. Don't allow yourself to be in that situation. Let me walk you through all of the process here. I'm doing my best to stay on top of everything as far as tracking all of the changes so I can help you even now, but absolutely throughout the year as well. Okay, so the drug costs, those numbers are locked in, but Part B, the premium, the IRMAA amounts, they're still being finalized. Okay, so I've heard and talked about quite a bit about the GLP Medicare Bridge program. So this is really interesting. It actually just went into effect this July, last month, on the 1st, and it's going to run through 2027. So December 31st, 2027 is when this will end. There's basically three medications, GLP-1 meds for weight loss. So if you have diabetes, you'll have the normal route of those drugs. This is a Medicare Bridge program, but it is not actually Part D. So, as we covered the deductible and the maximum out of pocket for prescription drugs, it's important to know that these work outside of that. So, if you have a weight loss drug, it's going to be $50 a month. So you don't, the good thing is you don't have to pay the full amount until you reach 700. You just pay that flat rate of $50 a month. Also, that $50 a month does not contribute to the true out-of-pocket max for medication. So it's not contributing to the 2,400. So just a little caveat there. And if you have extra help or LIS, low income subsidy, which I don't know what your situation is, but you should probably at least apply. See if you have that because that will help with medications and deductibles that are covered with for Part D, and so you have a reduced amount. That just does not apply to the GLP-1 bridge program, though. So your medications will be flat rate $50 regardless of who you are on this kind of program. Okay. So really important to understand there. I think that's it for the week. I will be looking for next week. If you need help with anything right now, let's get an assessment done. Let's do what I like to do is a baseline. Your doctors, your meds, the compliance, all that stuff. Get that out of the way, get it recorded so that later we can just double check and then get you into the plan that's going to serve you best for next year. And if I'm on your side, I'm your expert that you'll lean on as a resource throughout the year. All right. So just go to bobwisecarver.com and set up an appointment. I'll talk to you soon.